And now we'll move on to item number 3, which is public comments for items that are not listed on the agenda this evening. Individuals will be allowed up to 3 minutes. It is Council's policy to refer matters raised in this forum to staff for investigation and or action where appropriate. The Brown Act prohibits the Council from discussing or acting upon any matter not agendized pursuant to state law. And if you wish, if you could raise your virtual hand at this time. And I don't think we have any folks on the phone. They're all via Zoom or others. So right now I have 2 folks that have raised their hands for items not on the agenda. And I'll turn it over to the city clerk to please bring them in.
Paul Wapinski.
Good evening. Can you hear me?
Yes, whenever you're ready.
I recently watched on the news the reports of mountain lion sightings in San Bruno. I was wondering if the city is going to post any safety information regarding that, and specifically not on Facebook or Twitter for those of us who don't use social media. The second thing is I read that Millbrae signed an agreement with Bart to turn over some land for them to build apartments in a shopping area, and that's going to affect the high-speed rail. It's going to have to go underground, and I'm wondering if the city in the future could brief us on what effect that's going to have on San Bruno, and will there be digging and construction for the high-speed rail that's going to go through. Thank you.
Thank you for your comments. Next speaker, please.
Next speaker is Vanessa Melendrez.
Hi, can you guys hear me?
Yes, whenever you're ready.
Awesome. So, hello, Mr. Mayor, City Council members. I'm members of the community. My name is Vanessa Melendrez, and I use she, her pronouns. I am a proud resident of San Bruno as well as a member of the Peninsula VSA. So I come here today because I believe it's vital that the city of San Bruno passes a resolution in support of the Universal Healthcare Bill that's in the State Assembly right now, also referred to AB 1400, the California Guaranteed Healthcare for All Act, also known as CalCare, as well as the Medicare for All Act of 2021, introduced by Congresswoman Japal in the House of Representatives. So as you guys know, Americans pay more for healthcare than any other country in the world, yet our health outcomes are among the worst for rich countries. And with the COVID-19 pandemic that everyone's, I'm sure, fully aware of, it has shed some really harsh light on the inequities of the for-profit American healthcare system, as well as showing how vital universal healthcare is right now. So rather than tying insurance to jobs and skyrocketing fees, we need a system that puts patients over profits. Even in our community today, there are people who can't afford care, including folks like Christia Fiddler, whose niece was recently diagnosed with, I might butcher this, right, corneal craniosis. And these are actually stories me and my members got from San Bruno GoFundMe accounts for medical expenses. So these are San Bruno residents as well, showing that's really a local issue. They had to turn to GoFundMe to raise $15K for her life-saving surgery, and so far the family hasn't even gotten halfway to their goal. There's countless other stories I found online. If you guys would like me to share, feel free to reach out to Peninsula DSA. And our neighbors shouldn't have to rely on crowdsourcing for care. Even the CEO of GoFundMe says crowdfunding platform cannot and should not be a solution to complex, systematic problems that must be solved with meaningful public policy. Under a universal single-payer healthcare program, everyone will be covered for dental, vision, hearing, mental, pharmaceuticals, and more with no copays, fees, deductibles, or premiums, all free at the point of service. No one will be denied care or forced to use the emergency room because their doctor or coverage will, and no one will be forced to go into poverty due to the healthcare crisis. Besides bringing down healthcare costs for families, experts predict that single-payer Medicare would save the nation more than $600 billion annually by slashing administrative waste of commercial insurance, including paperwork and other burdens that insurers impose on hospitals and doctors. In addition to more than $100 billion would be saved by negotiating drug prices with manufacturers. As Congresswoman Donnell said, as part of the introduction bill, in the wealthiest nation on earth, patients should not be launching GoFundMe to foreign healthcare. In total, I'll wrap up by saying this bill is only it's a structure. Funding has not been figured out yet, but it's a good step forward, and I believe we should go through and write a resolution. Thank you.
Thank you for your comments. City Clerk, I'm seeing no other hands up at this time. Is that in concurrence?
That is correct.
Okay. Thank you very much for your comments this evening. And we will move on to item number 4, announcements and presentations. The first item will be with Jennifer Llanos, and that is received update on COVID-19 responses and efforts.
Good evening, Mayor and members of the City Council and members of the public that are with us tonight. I'm just pulling up the presentation here, so you should be able to see it in full screen. My name is Jennifer Llanos. I'm the assistant to the city manager, and I'm here to give you an update on COVID-19. Tonight, I will go through the blueprint for a safer economy. I'll provide a snapshot of our COVID-19 statistics for San Bruno and San Mateo County. I'll provide an update on city services and specifically with the library reopening with modifications. And lastly, a reminder to stay connected with us. I'll start with the blueprint for a safer economy. Each Tuesday, the state announces the county metrics. And so earlier today, the state updated our metrics. We have no change to our status. We're remaining in the moderate category of the orange tier here. The county metrics that are listed here on the screen are just shy of meeting that next less restrictive tier, the yellow or the minimal category. But we are going to stay in this orange category for now. With vaccination rates increasing and test positivity rates nearing a record low, the California Department of Public Health did announce updates to the blueprint for a safer economy. Beginning April 15th, there are changes to the allowances, and that includes outdoor gatherings with modifications. And I took a snapshot here just to show you the capacity changes for outdoor gatherings. In the red tier, it's up to 25 people. In the orange tier, which is where we are as a county, it's up to 50 people. The yellow tier is up to 100 people. There are also changes to private events, meetings with modifications, and indoor live events with modifications and limited to in-state visitors. So all of these are listed in the source reference that's up here in the orange header of the presentation itself, but that's covid19.ca.gov/safer economy. Governor Newsom also announced an update to our reopening plan, and that's beginning June 15th. California will fully reopen if 2 criteria are met, and that's if the vaccine supply is sufficient for Californians 16 years and older and who wish to be vaccinated and have a sufficient supply. And sufficient is defined as 2 weeks, and that's if hospitalization rates are stable and low. Moving on to county statistics, I have a summary table here of the dashboard that is available all through smchealth.org. The vaccination totals have continued to increase, and here you can see on the screen, San Bruno, 56 of our population 16 years and older have been vaccinated, and that's just a smidge over the county-wide percentage of 55.8. The completion of the full vaccination series, that data is not available for San Bruno, but county-wide, 65.4% have been fully vaccinated of the 55.8% that you see there that have started the series. Vaccination by health equity quartile. Health equity quartile is disadvantaged neighborhoods. San Bruno is about 48.2%, and that's slightly above the countywide average of 44.8%. So we're in good shape there. Our historical COVID-19 cases citywide for the city of San Bruno, there have been 2,289 cases and a total of 40,910 cases countywide. And in the last 30 days, there have been 77 new cases in San Bruno and 1,556 countywide. Total deaths, the breakdown by jurisdiction is not provided by the county, but there have been a total of 556 deaths. And as a reminder, now is no better time than now. Make sure to keep your distance, wear your mask, and wash your hands frequently to avoid spreading COVID-19. Moving on to the vaccine and testing. When you're eligible for the COVID-19 vaccine, beginning April 15th, all Californians over the age of 16 are eligible. So in the past, on social media and on our website, we have consistently promoted myturn.ca.gov. as well as smchealth.org/COVID vaccine. The phone numbers are also on the screen, but both of these tools not only notify you when you're eligible, but they also provide an opportunity to book an appointment to get that vaccination. Vaccine supply does remain limited, and that includes the announcement from earlier today with the CDC and the FDA citing concerns about the Janssen or the Johnson & Johnson vaccine. And the county issued a release earlier today pausing the county efforts with the use of Johnson & Johnson vaccine. And all of the events that have been scheduled and appointments that have been scheduled will be honored. The county was able to shift the Johnson & Johnson over to Pfizer or Moderna. So all of those appointments will be honored as of this time. However, other programs like mobile vaccination and other outreach programs will have to be reviewed before proceeding. Although vaccination continues, testing does remain a critical way to keep you, your family, and our community safe. And we've also promoted this on social media very often and on our website, but San Bruno has partnered with San Mateo County to offer no-cost COVID-19 testing to our residents and to anyone that works in our county. Those two locations are 530 Huntington, that's offered on Saturdays from 10 a.m. to 2 p.m., and at 975 Sneak Lane, that's Tuesday through Saturday, 9 a.m. to 5 p.m. And the bottom website reference here, smcgov.org/testing, if you happen to not be in San Bruno and still want to get tested. There are many other locations throughout the county that also offer free testing, and appointments are always preferred but not required. Moving on to city services, and I'm going to focus on the San Bruno Library. So as you know, several of our facilities were closed at the beginning of the pandemic, including the San Bruno Library. It closed as of March 14, 2020, and launched the curbside pickup in May of 2020. So it was closed for just about 2 months. Since launching curbside pickup, there have been over 72,000 items were checked out, and nearly 8,000 appointments were filled. So that's a lot of activity for the library. And I'm happy to provide this information to you, but beginning April 19th, the library will reopen with modifications. Those modifications are 25% capacity. There are wellness and temperature check requirements upon entry, and there will be special hours. So the special hours are in blocks of time, and this is really in an effort to allow for time for cleaning and between visits that come to the library. And so from 11 a.m. to 1 p.m., there will be a browse and go opportunity. 2 to 3, there's a curbside pickup. 4 to 6, there's a browse and go opportunity again. So 2 browse and go opportunities throughout the day. And what does browse and go service mean? It's browsing, of course, checking out and returning material, hold pickups, use of public computers for a limited time, computer printouts, you can get a new library card, simple reference questions. And it's really the services that do not require close contact, and that's for the safety of our employees and of our patrons. There are no change to parks. What you see here has been available for quite some time and has previously been reported. Everything that's here on the open side remains open, but I will highlight the closed. Picnic sites remain closed, drinking fountains remain closed, and indoor recreation facilities remain closed. Our EOC and department directors continually evaluate services as our status changes. We ensure compliance with guidance as they're issued. And I mentioned, I mentioned this last time, but in terms of next steps and summer programs, which is important to a lot of our community families, the activity guide will be released at the end of this month, and it will include summer camp and program offerings. And so there has been a couple of teasers, 1 or 2 that have been posted on social media, but that will be officially available at the end of this month. And as a reminder, please stay connected. SMC Alert is our emergency notification system. Social media, we provide updates, so stay connected. If you're not signed up, please sign up. That concludes my presentation this evening, and I am happy to answer any questions you may have.
Thank you, Jennifer, for your presentation. If you could stop sharing the screen, and then as my colleagues may start to raise their hand, just on the library, and correct me if I'm incorrect, but my understanding is the Angus side for the entrance will be the only available entry. Like in City Hall, it's on Linden. This is Angus. And I, the library personnel and staff are excited and preparing, but also just be patient because there are some modifications as was described. All the computers will not be accessible at one time because of the social distancing. Or if you're used to going in, maybe reading the paper and sitting there and reading it for an hour or so, that may not be available at this time. So understand it's exciting to see that go forward, but just understand the staff is excited to see the patrons, but just be patient because things obviously are modified for everyone's safety. With that, Councilmember Mason.
Thank you for the presentation and for the updates on both the camps that were requested from last month and also the update on the library. I just wanted to ask about two things. One is a vaccination pop-up coming to San Bruno. I know I've spoken with the supervisor a couple of times about this, and it seemed like we were getting close, and then it went to another city. So I'm curious to know, are we taking any opportunities to try to get a pop-up vaccination site in San Bruno, because we are one of the cities that has not had any yet. And then the second is just a thank you to all of the staff that were involved in the Easter Bunny home visits. I saw a number of pictures all over social media, and it just looked like an amazing event for the kids who got a visit from the Easter Bunny. So thank you for whoever thought of it and whoever worked on that. Thank you so much.
Vice Mayor Medina.
Oh,
yes,
wait, she didn't answer the question. Sorry.
Oh,
sorry.
I apologize. I apologize. Let's Rico pause. let's turn it over to staff.
Sure. So in terms of the mobile vaccination site, nothing has officially been scheduled or announced for the city of San Bruno, but as soon as information is available, that will be shared with the community. Right now, those mobile sites are really focused on the health quartile and have been in other close by neighborhoods. I know there's been one in South City, in East Palo Alto, in North Fair Oaks, and so I think there's a focus in those specific neighborhoods. But as soon as we have more information, we will report back.
Yeah, and we're not the only city that is not receiving one, and you're correct as far as trying to hit pockets that they feel are the need greatest at this moment. Vice Mayor Medina.
Yes, I want to share concern about how our picnic tables at City Park are kind of being used, and what's our view on that? It is outside. If families are gathering, that's okay, but it seems like more and more people are taking it easier there at the picnic tables, and just wanted to hear what we should be doing there.
I'll pause. City staff, please.
So I can take that back to our EOC team. Currently, there is signage that is available throughout the park, and it should be placed on the picnic table itself, showing closure. It is in accordance with the guidance that has been issued, but I would have to find out more to see if any changes can be made to that.
Thank you.
Councilmember Mason.
All right, I think you just one follow-up question to the vaccination question. So what can our city be doing to advocate for our site? So I do understand that there's like a method to this, but I also have seen some advocacy around cities, and so I'm wondering, how can we advocate better? Does the administration need direction from us? What can we do to advocate for our city to get a site?
City Manager, did you want to chime in?
Sure. I'll take that. Thank you, Councilmember Mason, for that. Know that we have been in communication with the county EOC as well as administration at the county, and they do know our desire for a vaccination site here. As Jennifer Dianos mentioned, currently the vaccination sites have been focused on health decisions, on communities and parts of our county that are seeing some of the greatest positivity with COVID-19, and so that is the reason. why the public has not seen a vaccination site here. With the limited amount of vaccines that are available, they are being prioritized based on health decisions. And so I would say that the county absolutely knows that we and everybody else wants a vaccination clinic. And we have heard from the county that as soon as they are able to ramp up their vaccination program, they look to either, one, extend it to cities like us, or return to their mass vaccination clinics. The council may remember that the county actually transitioned away from the mass vaccination clinics and went to these smaller, more tailored sites, frankly, based on the availability of the vaccine. And so these things are being actively managed. And so I think everyone knows.
And I appreciate staff's continued efforts as well as the council's drive because obviously at Skyline College we have Second Harvest Food Distribution on Huntington, which staff maintains, as well as on Sneath there are testing sites, which those weren't here before. So it's thanks to everybody's work in keeping the county aware of our interests. So thank you to staff. With no other hands up, thank you, Jennifer, once again for your presentation and your update. Now we'll move on under announcements, still under item B. Announcement. The Spring Community Cleanup event on Saturday, May 1st, 2021 will be held from 8 to 11 a.m. The event is located at 975 Sneath Lane, and residents, San Bruno residents, may drop off latex paint, bulky items, e-waste appliances, and bags of garbage. Residents are prohibited from dropping off dirt, rocks, or concrete. This is an event open to San Bruno residents only, and participants will be asked to show identification showing San Bruno residency. COVID-19 guidelines will be enforced, including the requirements of mask wearing. This event is sponsored by Recology and the City of San Bruno, which was a similar event which was held in the City Hall parking lot on October 17th. So again, that is open. Understand that for the residents that wish to come by, they will be asked to unload their vehicles into the appropriate sections for those disposable items. We want to thank staff and Recology for working on this project along with Councilmember Salazar and I, as well as obviously the church at 975 Sneath Lane, who has been very helpful to this community for this and other things. Moving on to item C, announced that there will be, it's not a possible, there will be a 9-week closure of the Bart garage due to retrofitting and upgrades to the lighting system. The garage will be done in phases. The garage in itself, in entirety, will not be closed. It will be done in phases, beginning with floors 3, 5, and that begins on April the 26th. So just wanted folks to be aware of that.